Professor Jose Saavedra talked about new insights gained on infant and toddler feeding and opportunities for obesity risk reduction in early years at the 85th Nestlé Nutrition Institute workshop. Professor Saavedra is the Associate Professor of Pediatrics at the Johns Hopkins University School of Medicine, Baltimore, MD, USA. Child obesity is one of the most serious global public health challenges of the 21st century, affecting every country in the world. In 2018, 40 million children aged under 5 years of age were overweight or obese globally. Overweight or obese children not only experience various immediate health risks, but also psychological or social problems. If children are obese in younger age, chances are overwhelming that they will stay obese later in life, compromising on their health and well-being. Already by 2 years of age, a toddler's body mass index can predict obesity in childhood and as an adult. To address the obesity epidemic, Professor Saavedra endorsed opportunities for obesity reduction that included preventative aspects starting early in life. An extensive systematic review indicates obesity risk factors with potential areas for intervention in early life as follows: dietary and feeding practices, behavioural practices, as well as environmental factors. Additional insights are summarized in the Nestlé Feeding Infants and Toddlers study, a large and representative study that investigates the diet and nutrient intake of infants and toddlers up to 4 years of age in many countries worldwide. As an important result, Professor Saavedra mentioned that analysis of the FITS data in the US suggests that toddlers develop less than ideal dietary patterns much before the age of 2 years. In the US, average energy intake of toddlers is more than what is required for the optimal development, especially when eating the family's diet in toddlers' years. Furthermore, sodium intake exceed tolerable upper limits, and iron intakes are often below the recommended levels in the US. Similar findings are reported for toddlers in other countries, such as Mexico and China. Knowing that consumption of vegetable and fruits tends to be critical in toddlers' years, the researchers were surprised that around 20% to 30% of toddlers in the US do not eat a vegetable or a fruit on a given day. In other words, by the age of 24 months, a toddler is more likely to get a dessert than a vegetable or fruit. In other countries, such as Mexico, toddlers consume lesser vegetables and fruits. A further remarkable finding of the FITS is that food preferences of toddlers are different when classified based on the energy intake. Toddlers with a relatively high energy intake eat more energy-dense foods, such as pizza, hot dogs, bacon, sausages, and cookies, than toddlers with relatively low energy intake. Apart from dietary factors, there are further opportunities for obesity reduction starting in early years. Professor Saavedra showed that lack of responsive feeding practices by the caregiver, lack of family meals, low sleep duration, or decreased active playtime have further effects on overweight and obesity trajectories. Concluding his talk, Professor Saavedra mentioned that there are opportunities in addressing the obesity epidemic already in early life by including preventative measures. The focus should not only be on single foods, but also on diet and behavioral practices. Moreover, addressing the obesity prevention in early life requires all stakeholders in a holistic way.